So I'm about to actually put the EMG tube in. I'm gonna make sure I measure placement. So from the nose to the ear to the xiphoid process, and mark that with tape. And then I'm going to lubricate the tip of the NG tube to make sure it goes down smoothly, and explain the procedure one more time. If they need anything, get an aide or another nurse to come in, and they're going to have a glass of water. And so I'm going to start to insert it through their nose. So as I'm going through their nose, once it hits their oropharynx, I'm going to look in, make sure it's not coming out their mouth. And once it's passing through that spot, have them lean forward, sip on water, take sips, and as they're swallowing, just pushing it down, that's making sure it goes down their esophagus and not their trachea into their lungs. So once that gets in all the way, it's not going to for this mannequin. Once it's to the place I marked it, I'm going to tape it down, make sure my patient's fine, that their O2s and their vitals are okay. If they were coughing while I was doing it, I would have just stopped and then continued advancing when they were done. So once that's in place, you need to get an x-ray to make sure it's in the stomach. I can check for pH, but I can't do anything besides hook the suction up until there's placement verification. I'm going to take my gloves off, perform hand hygiene, document, lower the bed, make sure the patient's comfortable, make sure their like their O2 and everything's okay still, and document how they tolerated it, where it's at in length, and what time it was done, and all those good things.